The Executive Chairman, State Primary Healthcare Development Agency, Dr. Rwanu Mohammed, said 2021 was a trying period as the agency had to contend with the ongoing COVID-19 pandemic and the outbreak of Lassa, yellow fevers, and cholera. The year was characterized with the epidemiology unit being on the field always carrying out active case search and immunization against yellow fever, COVID-19, and cholera. The agency was able to contain the yellow fever outbreak and that of cholera. Efforts are ongoing to minimize mortality from Lassa fever, and that has been reported in 7 local government areas of the state. Dr. Rwanu Mohammed said the year saw government purchase a site along Round Road for use as permanent headquarters of the Primary Healthcare Development Agency. The price stood at 150 million naira, and currently work is ongoing at the site.
His Excellency, the Executive Governor of Bauchi State, has approved the purchase of our headquarters along Round Road. Former Ambassador Balarabe's house as a headquarters of primary healthcare. He paid about 150 million to actually purchase the place from the siblings, and he also gave approval for renovation, upgrading of the place of 184 million. That was the approval he gave Bauchi State Primary Care Development Agency, but the Ministry of Works came and modified the activity. They modified the activity, and so that all our partners in Bauchi State, except UNICEF, WHO, and IHP, are going to be accommodated in that building. So at least a improvement of our 97 million was also added in order to capture all other construction and upgrading of the facility.
The state government paid 44.7 million naira as counterpart fund for an $18 million World Bank assisted immunization plus and malaria progress by accelerating coverage and transforming services. Impact project will provide intervention in 323 primary healthcare centers across 20 local government areas. In 2021 also, the state paid 187 million naira into the primary healthcare basket fund, in line with the MOU signed with Bill and Melinda Gates Foundation, Dangote Foundation, UNICEF, and USAID.
But there was a new agreement between 2021 to 2025 between MOU partners. The addendum was signed, but let me tell you, the agreement is for 4 years financial and 1 year technical. And unfortunately for the MOU partners, only Bauchi State was able to pay its counterpart fund 170 million last year. All the partners did not pay, and the agreement was signed by all the partners, but they did not fulfill the agreement. They agreed to pay double the amount this year.
The State Emergency Maternal and Child Health Center (SIMCHEC) received a boost with a recognition from the Federal Ministry of Health as the best performing intervention in the country. Dr. Rwanu Mohammed said in 2022, the agency will focus on community campaigns on preventable diseases, while the 800 trained community resource groups will be visiting house to house with key messages on maternal, newborn and child health, routine immunization, nutrition, and childbirth spacing services.
I told you one of the major problems we have is human resource in our facilities, both general hospital and primary healthcare. We engaged 220 midwives into our facility recently, and on a contract basis at 30,000 naira per month. Even yesterday, I paid for December because we have to check whether they're in the facility or not before we pay them. 120 are paid by Basic Healthcare Provision Fund, and then 100 are supposed to be paid by the Save 1 Million Life, and they are the one paying those workers at the cost of 30,000 naira per month. We are going to do that, and until we are able to get those staffs engaged before we now release those on contract, because we have a lot of at the interim we are using this contract staff to take care of the gap we have in the healthcare.
Elizabeth Kapp, BATV News.